Hello, my name is Ariel Rogers, and I am currently a senior nursing student at Boise State University, and I want to talk to you about the necessity of gender-affirming healthcare. As someone who's transgender and has struggled with mental health all my life, this topic is extremely important to me. A study in 2020 found 40% of transgender individuals have attempted suicide at least once, and 82% have seriously considered ending their own life. These numbers terrify me, knowing how many people have felt like they were better off dead, especially since I personally know other trans people who've tried to take their own life many times before. Thankfully, studies have found that transgender and non-binary youth who received early and age-appropriate gender-affirming care were associated with 60% lower odds of depression and 73% lower odds of suicidality. But still, there are laws being passed trying to take away this life-saving gender-affirming care. Just this year, the Idaho House passed the strictest bill in the country criminalizing gender-affirming healthcare of the transgender youth in the state. This has since been voted down by the Idaho Senate, but it's bills like this that contribute to the declining mental health of transgender people. I'm asking you to protect transgender people's rights to healthcare and life. Currently, Idaho has no laws protecting LGBTQ inclusive insurance protections and no explicit state Medicaid policy that covers healthcare related to gender transition, allowing people to be unfairly denied and excluded from health insurance coverage. We can already see insurance taking advantage of transgender people right now in our state because of this lack of protections. Two transgender women in Idaho right now are suing the Idaho Department of Health and Welfare for unreasonably denying and delaying treatment of gender dysphoria. One of these people, an 18-year-old girl, reported that it has been 17 months since she requested coverage for a service that her providers said is medically necessary, and she's still not heard a final decision, nor have they granted her the ability to appeal. Just like that, just like a lot of other transgender individuals, this girl has attempted to take her life before, and according to her parents, they are worried that she may try again. As an elected official, I know you too are concerned about the health of our people and for the prosperity of our state. A concern that you may have for providing gender-affirming health care could be how this will affect the economy, but studies have found that providing this care is actually cost-effective. They have found that people who are transgender and are not able to transition are highly linked to increased risks of depression, substance abuse, and HIV. Providing support for medically transitioning now will save the country thousands of dollars by decreasing the costs they would have spent on treatment for depression, substance abuse, and HIV and AIDS. It's a small thing that can be done for a big impact on the people in our state. Thank you for taking the time to listen to me, and I hope next time a bill comes up for or against gender affirming healthcare that you'll remember this conversation we had when making your decision.